Hey, it's Susanna, and today I'm going to give you an overview of the Mediterranean diet and teach you a method for assessing your own diet by calculating something we call the Mediterranean Diet Score. The Mediterranean diet is a style of eating based on 9 components that I will go over in detail. This style of eating has been shown to have a profound effect on patients' health, reducing mortality from both vascular disease and cancer. Vegetable consumption is an important part of the Mediterranean diet. Women should shoot for 9 ounces per day, while men should aim for 11 ounces per day. This roughly looks like 2 medium carrots, 8 asparagus spears, a cup of sliced squash or zucchini, or 1 1/4 cups of broccoli. If your eating habits meet this criteria, add 1 point to your Mediterranean diet score. Legume consumption is also important. Women should shoot for 1 3/4 ounces per day, while men should shoot for 2 ounces. This roughly looks like either a 1/4 cup of chickpeas, 3 tablespoons of raw peanut butter, or a 1/4 cup of raw lentils, a 1/3 cup of kidney beans or soybeans, or 2/3 cups of frozen peas. If your legume consumption matches this criteria, add 1 point to your Mediterranean diet score. Fruit and nuts are full of vitamins and minerals and are an important aspect of the Mediterranean diet. Women should aim to get 8 ounces in their diet per day, while men should shoot for 9. 1 large apple, 2 bananas, or a cup of nuts are all roughly equivalent to 8 ounces. Add a point to your Mediterranean diet score if your consumption matches this criteria. The Mediterranean style of eating encourages limited dairy consumption. It is recommended to limit your consumption to less than 7 ounces per day, which looks like 1 cup of yogurt or a cup of sour cream, or 7 slices of cheese. When possible, opt for fermented dairy products like yogurt and cheese, which have shown health benefits, and lower fat dairy options like low-fat Greek yogurt. If your average daily dairy consumption is less than 7 ounces per day, add a point to your Mediterranean diet score. The Mediterranean diet also includes cereal or whole grain consumption. Women should consume at least 9 ounces of whole grains per day, while men should consume 10.5 ounces. This could look like a cup of bite-sized shredded wheat cereal, 2 slices of whole wheat bread, a 1/4 cup of brown rice, a 1/2 cup of whole wheat pasta, or a 1/3 cup of uncooked quinoa. If you meet this average daily consumption, add 1 point to your Mediterranean diet score. Fish consumption is also encouraged by the Mediterranean diet, especially when it can be used as a replacement for red or processed meats. You should shoot for 2 4-ounce servings of fish per week. This could look like 2 cans of salmon, tuna, halibut, or sardines, or 2 similarly sized fillets. If your diet includes 2 or more 4-ounce servings of fish per week, add a point to your Mediterranean diet score. Meat consumption is limited in the Mediterranean diet. You should aim to consume no more than a deck of card-sized serving of meat each day. Whenever possible, meats like chicken breast, and avoid processed meats like sausage, bologna, and hot dogs. If your average daily meat consumption is less than 3 1/4 ounces, add 1 point to your Mediterranean diet score. Alcohol in moderation is another aspect of the Mediterranean diet. Women can consume 5 to 25 grams per day, while men can consume 10 to 50 grams per day. This looks like 1 12-ounce beer, 1 5-ounce glass of wine, or 1 1-ounce shot of spirits. If your daily alcohol consumption isn't within this range, add 1 point to your Mediterranean diet score. If you do not drink, talk to your doctor before adding alcohol to your diet. It may not be a healthy choice for everyone. Finally, the Mediterranean diet encourages consumption of healthy fats such as olive oil, canola oil, grapeseed, and soybean oils, while limiting the consumption of less healthy fats like hydrogenated vegetable oils, stick or hard margarines, butter, lard, and vegetable shortening. The optimal ratio of healthy fats to less healthy fats is 1.6. If your healthy fats ratio is 1.6 or greater, add 1 point to your Mediterranean diet score. Now, based on these 9 criteria, add all your points together and calculate your final score. It'll be somewhere between 0 and 9. Don't worry if your score is on the lower end. This only helps shed light on some areas for improvement. Now take a minute to reflect on what changes you could incorporate to improve your Mediterranean diet score. This could look like swapping out red meat for fish 2 nights a week. Or maybe you want to work on incorporating more legumes into your diet. You could try swapping out processed snack foods for apples with peanut butter or carrots with hummus. Take this opportunity to identify one aspect of the Mediterranean diet score you want to focus on improving. Over the next week, focus on incorporating this one change. Small changes can have a big impact on your overall health. Thanks.